Medical debt is something far too many Californians are dealing with every single day. Nearly 40% of our constituents in California are affected. What's especially troubling is that this isn't just people without insurance. Many people do have coverage, still end up with bills they can't afford. High deductibles, co-pays, denied claims can leave families owing thousands of dollars, and they never expected would happen. And when those bills go unpaid, they're often sent to collections, damaging credit for years and making it harder to find a place to live, to get a job, or take out a loan. That kind of financial pressure forces people to make difficult choices. Every one of us here, and those watching today, knows someone who's had to make a choice at some point between getting health care or paying for basic living needs. Or maybe it was you. You had to make a choice for yourself. Many people delay or skip care altogether, and some struggle just to keep up with basic needs like rent or groceries and utilities. Now we've seen there is a better way. In 2024, Los Angeles County launched a pilot program that erased $363 million in medical debt with just a $5 million investment. They did this by purchasing debt on the secondary market for pennies on the dollar and then canceling it. AB 2123 builds on that proven model by creating a statewide medical debt relief program. Under this bill, the state will partner to purchase and cancel qualifying medical debt for low and middle income Californians. It prioritizes those earning up to 400% of the federal poverty levels for those carrying higher debt compared to their income. This is a practical, cost-effective way to help millions of Californians get back on their feet so they can focus on their health, support their families, and fully participate in our economy.
26% of the households across the country experience some sort of medical debt. And the group most burdened by medical debt are people between the ages of 50 to 64. These are the sandwich generations, those that are taking care of their kids as well as taking care of their parents. And so, like the Assemblywoman said, sometimes you have to make those choices on what are the priorities. And taking care of yourself and paying back your medical debt may not be the highest priority, but it looms over someone's head. It stays over their credit. It affects them in terms of their mental and well-being as well.
And I'm here today as a caregiver and as an aunt who lost my nephew, Daniel, at the young age of 35. Daniel was diagnosed with stage 4 colon cancer at just 27 years old. During that illness, I helped care for him and support him through treatment. While he was in the middle of that fight, he lost his employer-sponsored insurance after going on disability. He then had to transition to Medi-Cal. During that transition, there was a period of uncertainty that directly affected how he thought about his care. He began asking questions like, can I afford to continue my care? Should I buy my medicine or groceries? Take out a loan? Instead of focusing solely on fighting his cancer, he was forced to weigh financial risk against medical needs. That uncertainty changed the way he made his decisions. It introduced hesitation at moments when time and clarity were critical. No patient should ever have to second-guess treatment because they're worried about cost or coverage. Although Daniel was eventually able to enroll in Medicare and continue care, the gap created stress and fear that never should have been part of his experience. And before that transition, he already accumulated a lot of medical debt. The debt didn't just exist on paper. It influenced how he viewed his options and his future. It was something he carried with him even as he was fighting for his life. The debt remained unresolved at the time of his passing. What I saw firsthand is that medical debt and coverage gaps don't just impact finances, they shape decisions. They affect how patients think, how they plan, whether they are secure enough to continue their care. Daniel deserved to focus on his treatment, time with his family, not whether he could afford to keep going. This is why policies like AB 2123 are so important. This is about reducing the financial pressure that interferes with care and ensuring that patients can make decisions based on what they need, not what they can afford.
I'm here not just as an advocate and a public health expert myself, but as a young stage 4 colon cancer patient. I want to speak briefly about the real cost of living and staying alive. When people hear that someone has insurance, as the majority leader said, they often assume that those means are protected. That's just simply not true. It does not mean that care is affordable, and it does not mean that the bills just stop coming. For patients like me, the cost of survival is staggering. My treatments come with a $2,000 copay every time. I have an outstanding $500,000 medical debt for a necessary biopsy. My monthly medications cost several $100s before anything else. These are not optional expenses. They're the cost of me staying alive. Many patients still face barriers to getting the care they need. No one chooses cancer or chronic illness. No one chooses medical debt. Patients should be focused on treatment, on their families, and on surviving, not on whether or not the next bill will destroy what's left of their very small lives.
We're still working on it since we don't know how many people have medical debt that would qualify at this moment. So part of this press conference is trying to assess people to come out and share their stories with us so that we can get some sort of ballpark, since people don't report it on the tax return